Cracking the joints. Many of you wonder if it is safe and how does it work? What's the science behind it? How is it that we see videos of patients walking in an office of chiropractor unable to stand up straight and in severe pain, and then in one treatment session you see them walking straight as if they have no injury? That's what today's topic is going to be about, so stay tuned. Welcome to the second episode of Kent Chiro-Med Podcast. I am Dr. Raphael, and joining me today is Dr. Courtney. We are both chiropractors, and we are here to educate you about everything you need to know about chiropractic spinal adjustments. Please remember that our content here is for informational purposes only, and because each person is unique, please consult with your healthcare professional for any medical questions. Hi Courtney, how are you?
Hi, I'm good. How are you?
Not too bad. We want to start the conversation today by defining what is an adjustments. So can you give us a bit more information about that?
Sure. So I feel like chiropractors are most well known for our adjustments. We call them manipulations. Most people know them about like the spine, but we do adjustments on most joints of the body. Basically what an adjustment is we take the joint to its end range, its natural end range, and then we kind of thrust a little bit past it, just making the joint move a bit more. That's basically what an adjustment is. It's nothing to be scared of.
Yeah, exactly. And also adjustment comes in different techniques, right? Mm-hmm. So a technique for the neck, technique for the lower back. So every patient who comes in with specific injuries in certain body parts will have a different technique, right?
Yeah.
So like, for example, a lower back setup, how would that be, for example, for an adjustment? So the patient would be like, in what position?
Most commonly, people will be on their side in a side-lying position for the low back. Sometimes you can do it face down. That's kind of more the pelvis adjustments and drop piece adjusting, but yeah, most common is on the side. Mm-hmm. And then for the neck, it's usually on your back. But there are a bunch of different techniques. So we were trained at the same school, so we do probably all the same adjustments. But there are different schools that teach different techniques, I guess.
Yeah, I think what me and you do is called diversified chiropractic treatment. So it's an adjustment that's will cause, later on we'll talk about the noise that actually comes up from a joint that's been adjusted, because everybody is so curious about where that noise comes from. So like for me and you as chiropractors, that's the most common questions we do get from our patients, like what happens with the noise and stuff. But we'll elaborate on that later on for sure. So the next question I'm going to ask you is, why do people come to see us to get an adjustments? What was the reason for that?
The most common reason people come and see us is probably because they're in pain. So they're looking just for some help to relieve their pain, which we can definitely do with adjustments. Another common thing that people come see us for is just like functioning purposes. So if people are struggling to move in certain ways, that's also where adjustments can come into play and help the joint move a bit better, and then help the person just function better, like in life. And then there's also just like maintenance patients who feel better just getting care every so often, and it kind of just helps keep the body moving well, feeling better, preventing any further issues from coming up.
So we're pretty much like an expert of getting people to be moving, being able to move, right?
I would like to think so.
Right? So it's an expert of helping our patient be able to move without having pain.
Yeah.
I think that's the main purpose. We want to get people to have the ability to be able to move without having to suffer through their motion, because we're here to unlock a stiffness that's been occurred, whether with a trauma or any specific injury that led to the stiffness of a joint, and we're here to just allow the stiffness to go away, unlocking the range of motion, therefore pain reduction. Mm-hmm. Right? Now, another question I want to ask you, Dr. Courtney, is who are the best chiropractic patients that can benefit from chiropractors? I mean, like, do everybody can benefit from an adjustment in general, or there's certain criteria for that? how would you go by that?
In like short, I would say most people can benefit from an adjustment, but not every single person should be adjusted. I would say like there are certain things where we definitely look out for this during our initial assessment to make sure that our patient that we're treating that day is a good candidate for the adjustment. Some just like quick things of who we would not adjust would be like somebody who's already very, very mobile or hypermobile, as we would say. Sometimes there's like certain conditions that cause people to have hypermobility. So that's something that we look out for on our initial assessments. So that's somebody that I wouldn't adjust. Other people that we have to be a little more careful with are people who have low bone density. So this is typically more seen in our like elderly populations, but we are well equipped to treat these people anyways, just with different techniques. They just might not be adjusted, or they might be adjusted in a more gentle manner. Some like congenital conditions also, but for the most part, like all in all, I would say the majority of people can benefit from it, and we're well trained to know who is a good candidate and who isn't, and that's something that we do on our initial assessments when you come to see us.
Absolutely. And I think like all the chiropractors in our clinic, and just chiropractors in general, are an expert at muscle and joints illnesses. So we're here to know every time a person comes in our clinic, like this is a candidate for that adjustment and this is not. So we have, like, we provide reassurance for our patient, knowing that, like, I know your injury now. We ask the proper question, we assess you properly, and the good news is, yes, you're able to get an adjustment. In some cases, you know, unfortunately, they're not a candidate for an adjustment. Just like you wouldn't get anybody to have, like, say, you know, like a family doctor wouldn't necessarily know more about medication. So somebody would like, medication A would be better for this person versus medication B would be better for that person. So it's all relative to the patient that we're assessing, right?
Yeah, and that's something I didn't really touch on, but patient preference too is a big thing that I take into consideration. Like, I'm obviously a chiropractor and I love providing adjustments for people, but if I know that somebody isn't comfortable with it or that's not what they want, I'm never going to push an adjustment on somebody if they don't want it, because part of like caring for our patients is doing what they want.
But absolutely, and this is another topic definitely we want to discuss about later on. Thank you for bringing this up. This is the chiropractic typical visit for an initial assessment versus a regular appointment. What can someone who never been to a chiropractor expect in those two different visits, right? So we will talk about that for sure later on. I want to also clarify on something. We do not necessarily adjust the entire joint in the patient's body. And even in one body parts, let's say the neck has two sides, we don't necessarily adjust both sides in most of the cases, because sometimes you find like severe restrictions on one side that we don't want to touch, and the other side is working fine but just like stiffer. So we probably would adjust the side that's not like abnormally restricted, so we just let it, you know, be on its own. So I feel like our approach is more like what needed to be done will be provided, but if it's just not needed, we don't provide it. Right?
Yep.
All right, I want to ask you more now about what is a chiropractic typical visits. So for somebody who never been to a chiropractor before, who walks in the clinic of a chiropractor for the first time as an initial patient, what can she or he expect?
Okay, so the first thing you're going to do, hopefully before you get to the clinic to save a little bit of our time, is fill out your paperwork. Please do that before you come to the clinic.
Please do that, because that like takes forever, because it takes from our time. Like, do we have an hour with them, right?
Yeah.
So they spend like 25 minutes filling out the paperwork in the clinic. It's like, I'm so sorry. Like, I feel stressed.
Yeah, because then it cuts into the time that we have to assess you. So the paperwork just gives us a better idea of who you are as a whole person, because we're chiropractors and we focus on musculoskeletal problems, but we want to get a good idea of like everything going on in your body, not just the musculoskeletal problems, so that we don't miss anything and we just make sure we have a good picture of who you are as a whole person. That's why I love chiropractic, because I feel like we're so detailed with our examinations and like getting to know our patients. So yeah, that's step one, paperwork. And then you'll come into the clinic, you'll meet our friendly front desk staff. And then once you start the initial assessment with us, we are going to talk to you more about what we saw in your paperwork, and then also like what you're coming in for, what your goals are, what your problems are, all that kind of stuff. And then once we're done the history taking, we're going to do a physical exam on you. So this requires us to like move you around and do some tests just to make sure that we understand what's going on with your pain so that we can better help you. Once we figure out what's going on, then we'll just talk to you about what we found, what we think is going on in your body, and what we plan to do to help you. Then we'll go over, this is a very lengthy process now I'm realizing, but then we'll go over our consent form. So this is just talking about different risks for chiropractic care. So like any type of treatment, chiropractic care has some risks, but that comes with any form of treatment. And to be honest, like chiropractic care is very safe. We talk about it in the consent forms.
Absolutely.
But there are some minor risks. And then once you sign your life away to us, then we'll do a quick treatment for you. The first treatment is usually a little shorter than the subsequent treatments, I find, since I spend a lot of time on assessing. Yep. So we'll do a quick treatment for you just to hopefully get you feeling a bit better before you walk out of the office. And then the next time you come in, you'll have about like 20 to 30 minutes with us, depending on the practitioner. But it'll be a full treatment, a quick assessment at the beginning, but just to make sure everything's the same as last time. And then we'll treat you, make you feel better. We have a bunch of different treatment styles and methods that we use. We're talking about the adjustment mostly today. That's what we're most well known for, but we have a bunch of tools in our toolkit. So we like to work on the soft tissue therapy, or soft tissue with soft tissue therapy. We do mobilizations, which is kind of like a gentler version of an adjustment. Then we have a bunch of like different tools in the clinic here. We've got shockwave, we've got IFC, all kinds of fun stuff.
All kind of torture devices.
Yeah. Oh God, there's an evil laugh coming out. Yeah. And then like exercises and education. But yeah, that's pretty much what we do at the clinic. I don't know did I answer your question? I feel like I went on a whole rant.
No, absolutely. And I think also one of the most unique thing about our practice at Kent Chiro-Med Wellness Clinic is the atmosphere, the ambience. I got a lot of patients who comes in and see us, they tell us, it feels like it's a family member welcoming you or like a best friend welcoming you. It feels like we're so easygoing with our patients. We're so chill that when we actually welcome them, it just feels like even like 90% of all the stress comes out of the patient's body. I'm like, I can immediately in the first 5 minutes of just hearing you talk, I know that you're knowledgeable. You are here to treat me like you would treat your dad, your mom, your siblings, like with the same respect, the same care, the same attention to details, being able to be actively listening to them, hearing their worries. I always tell, like back in the days we used to, have this doctor and patient relationship where we're like towering over the patient and telling them what they need to do. Now, with modern times, with modern ways of doing things in chiropractic and medicine in general, is that patients are active team member of their own recovery. We're just here to guide them. We have the knowledge, but whatever patient objectives are, we help them achieve it. So, for example, if you have somebody with low back pain and is an office worker versus someone who's a professional runner, obviously their goal is going to be different. Therefore, our style of treatment will be way different in terms of adjustment in general or just in terms of the way we approach healing these people. Yeah. Right?
We don't want to be like a superior person in the room. I don't think any of our practitioners feel that way. That's why I think our patients feel so comfortable in our clinic and they feel comfortable to tell us like everything about their lives. So then we're able to help them better reach their goals. Whereas, not to hate on any profession, but sometimes with medical doctors, because they're so busy and they don't have time, sometimes people feel like they can't open up to their medical doctors. So I like that about our profession and our clinic, that we just create such a nice environment for our patients, I think, anyways.
Absolutely. And then we spend a lot of time also as chiropractors. Like our standard visit, 20 to 30 minutes, is not an adjustment and then you leave. We all, like you said earlier on, we do a lot more than just like a 5-minute adjustment and then the patient leaves. And I feel like the secrets of our vision and mission in our clinic is that we sincerely want to get to know our patients. So we want to help their family member, we want to help their friends.
Yeah.
It becomes a way of living. It's not like only just a treatment. I think it's just getting them to, if they have, let's say, they may disappear and not see us for, let's say, a year, but then if they have a severe headache or jaw pain, they remember, oh, Dr. Courtney helped me before, or Dr. Miriam, or Dr. Raphael, or even our physiotherapists. They remember us because we leave an impression that's memorable, and that's what we're here for. Yeah. We're here to transform our patient life, and not just like giving them a treatment and then they leave.
Yeah,
right.
I agree.
Okay, the $1 million question, the cracking sound, the noise.
Yes.
Earlier on was so funny, guys. She told me, please don't go too much, ask me question about the science behind it, because then it's too complex.
You're throwing me under the bus. How rude.
But like honestly, the science behind it is much more complex than it is. But for just simplifying it for our patients, what can you tell us about the origin of the noise?
Yeah, so that's like a big question I feel like a lot of patients have when they come in, especially if somebody is nervous about chiropractic and they're like, what's that popping sound or cracking sound? So we're not breaking bones. We're not cracking bones. We're here to help you. We're not here to hurt you. Basically what an adjustment is, like I said earlier, is that we're taking the joint to its end range and then pushing past the end range just to get the joint moving a bit better. And the joints that we work on as chiropractors with our adjustments is called synovial joints. So these joints are essentially filled with a fluid called synovial fluid.
And what's the purpose of the synovial fluid?
It just helps like lubricate the joints and
get them to move with ease.
Yes, exactly. So there's synovial fluid in the joints, and if you can like take a few years back in your memory and think of your science class in like grade school when we talked about different substances and how substances can change from like solid to fluid to gas. That's essentially what's happening when we do an adjustment. So we have the synovial fluid in our joint. When we expand the joint or do the adjustment on the joint, it increases the space of the joint and increases the volume of the joint. When this happens, there's a pressure change in the joint. So the pressure decreases, the synovial fluid converts to a gas, and you hear the popping sound. It's that simple.
And the popping sound is harmless.
It's very harmless. It's literally just synovial fluid changing to a gas.
And it's just like this is what I'm trying to help them understand. It's just an audible sound. It's an audible sound that has, but the issue is not. It's not the issue. It's like the one we should focus on is just not the sound only. It's just what's the process underlying the few seconds before the sound comes in, right? This is where when you adjust it, what would you expect a person to feel like after an adjustment?
Yeah, so because we're changing the pressure of the joints, lots of people feel just like I get a lot of like, oh, I feel so much lighter because people just feel so much less pressure in their joints and they just feel more mobile because with adjustments, I don't know if we touched too much on it yet, but we relax the muscles. There's all the science that Dr. Rami will talk to you about, but we relax the muscles, we change the pressure in the joints so people just feel better. They feel looser, they feel lighter, they feel more mobile after adjustments. And it's just as simple as changing fluid to gas.
And also, I'm just remembering when you're talking to me about what they're supposed to be feeling after, getting adjusted and they hear the sound. It's like the diverse reactions of patients. Yeah. Vis-a-vis this entire it's just I've been like practicing for a while that it never ever gets old. You know what I mean? Like the diverse people's reaction to the sound.
I think the most common one for like people who have never gotten an adjustment before is just laughter. I adjust someone and they start laughing and I'm like, okay.
And I remember my first adjustment I ever received before I even was a chiropractor. It was just I couldn't stop laughing for 5 minutes. Something about an adjustment is like, it's so surreal. It's so like bizarre. Like it's coming from a joint, and you don't hear certain joints in your body other than your knuckles like being adjusted. And it's just it's just such a funny experience, I find.
Yeah.
I've also had from patients who, no matter how often you like educate them, it's just like they have to have the experience, and because they have nothing else to compare it to, when you give an adjustment, it's like their first instinct they do is like they start screaming.
Yeah.
And it's not like it's screaming out of pain. It's just like they just get surprised.
It's more a startling thing. Yeah. I always warn my patients too, because I always start with the upper back because it's less scary for people, even though adjustments aren't scary. But then whenever I move to the neck, I'm like, okay, you're going to hear the exact same thing, except it's going to be louder. The joints are closer to your ears. This is why. So don't be scared.
And also, I think it's the way we present ourselves, our clinical confidence.
Yeah.
I think it's infectious. The fact that, like if you come in with the confidence and you reassure them and you make them feel better, and the patient feel it. Like, if you're not as a chiropractor combining empathy with a little bit of confidence together, they're gonna feel like they're not in the right hands.
Yep.
No matter how knowledgeable you are. I think it's the fact that with clinical experience you're able to, for example, know the person's personality. Because that's important, like knowing the patient's character and how you would approach it.
Yeah.
Right? Because I always tell my patient, adjusting someone is a science. How to approach an adjustment to someone is the art side of it, the art of communication. So I think like we need to, as chiropractor, be experts in both. Not only treatment, but the way you administer the treatments.
Yeah, and that comes back to just us getting to know our patients very, very well. And that's why everyone at Kent Chiro-Med is awesome. That's
why we're so busy. Like we're knock on wood. I'm not gonna do it here because it makes the microphone really act weird. But we're thankfully we're very well liked in Ottawa, well sought after because of our sincere appreciation, and the fact that we're doing this podcast is just an attestment to the fact that we are passionate about just educating our patients and getting them to know. About the stuff that raises question marks, like especially the noises from an adjustment that we get asked almost every day for the rest of our life as a chiropractor, right?
Yeah.
I want to ask you, do adjustments hurt?
They shouldn't. However, they can sometimes. So
what kind of scenarios you would think by experience or just in general, I wouldn't say experience, but like in general, what would cause an adjustment to hurt?
So sometimes when people are in such acute pain, like their pain is really new and really intense, then sometimes adjustments can be a little uncomfortable. And again, like we assess the patient to know if today would be a good day to start adjusting them or if we should wait just for everything to kind of calm down a bit before adjusting. So that's like one of the most common ones. Also, I always tell my patients, like when we go through the risks and everything, one of them is like sprain, strain, temporary worsening of symptoms, that kind of stuff. So I always tell them, like, the more you're able to relax and accept the adjustment from me, then the less likely you are to be sore. Because if somebody's fighting you, like trying to do the exact opposite movement that you're supposed to do or trying to do with their body, then sometimes they can strain a muscle or just get a little bit sore because they're trying to fight your job, essentially.
I agree with you. And I think there's certain ways we can mitigate that, right? So there's something we call pre-adjustment treatments.
Yep.
So an example, just a heat pad. I tend to put music for my patients during the session so that music helps them distract, so they're not like hearing their anxiety in their head.
Yeah,
right.
True.
So it calms them down. Starting with soft tissue, because I believe that muscle attach on joints, and when joints are inflamed, muscle tend to guard them. So if we work a bit on soothing the muscle by stretching, doing myofascial release, soft tissue, Graston, you name it, getting them to get used to our hands, to touch our hands, right? Because it's so powerful. Like just getting someone you don't know touching you, that's already like almost an aversion, right? To touch, because you never got any chiropractor to touch you before, like in terms of like your injury. So that humanistic barrier of the human touch, you need to condition your patient to recognize that I'm here to help you. Just by touching them, just touching the area, soothing it, making it relax, getting it warmed up, and then you do an adjustment and you notice it's just so much smoother than just like going in cold and giving them an adjustment, especially if they're, like you said, in severe pain. Is there anything else that you can make a person have a bad reaction to an adjustment, like make it painful? Is there any other scenario you can think of?
I mean, like, there's always a chance for people to be sore after an adjustment. I always tell my patients, like, if this is something you're not used to, then it's kind of like going to the gym, working out muscles that you're not used to working out. You're going to be sore before you feel better. Same with the chiropractic adjustment. Like, we're moving your body in ways that it might not have moved in years or ever. So you might be a little bit sore before you feel better, but chances are you'll feel a lot better once you start to feel better.
Absolutely. It's the same when they say, like, it gets worse before it gets better kind of thing. So I feel like there are some side effects to an adjustment, but they are side effects that are transient.
Yeah, they're very, very temporary.
And I always tell my patients straight after, especially those who have been 18, 19 years of pain and who never had an adjustment before, I tell them straight out, it's gonna get sore. You're gonna get, the area is gonna feel tender. It's gonna get inflamed. You're gonna feel warm in the area, a bit hot. You're gonna feel like temporary worsening of your symptoms because your body recognizing like, oh, you've done something different when I'm not used to this, right? So then how do we mitigate that? So we tell them like, ice pack, a lot of rest. We give them gentle stretches and then we follow up with them, right?
Yep.
Absolutely. But in general, adjustments are considered safe, right?
Very, very safe.
Very, very, very safe. So there's no reason, like we want to have our patient alive. Like we want them to be happy. We want them to be sincerely healthy. Like we're not here to harm people. We want to here to help them, and we are an expert at our knowledge of muscle and joint pain, right?
Yep.
Excellent. Well, anything else you want to add on, Dr. Courtney?
I don't think so. I think we covered everything.
That was a pretty good podcast, right?
I think so.
Yeah, I think so.
Still
we're getting
this.
the hang of it. Exactly. Well, thanks for listening to the Kent Chiro-Med Podcast with your hosts, Dr. Raphael and Dr. Courtney. We hope you enjoyed our deep dive into the topic of chiropractic adjustments. As usual, you can head over to www.kentchiromed.com to become a new patient. And please follow us on social media. We'll add the link to the description, so just make sure you check that out. And that's it for this episode, everyone. We'll see you next time. Stay safe, stay healthy, stay happy.